Unanimous consent to suspend the quorum call.
Without objection.
Madam President, the issue of quality, affordable health insurance is personal to me. I know what it feels like to be a new dad with a beautiful little baby girl with a serious medical condition. It happened in my life when I was a student in law school at Georgetown here in Washington, D.C. God gave us this beautiful little girl, but I didn't have health insurance as a law student. We ended up in the charity ward of the Children's National Hospital, waiting for our name to be called to be introduced to the doctor, the new doctor at the hospital, who would do his best to help my daughter. I thought about it as I sat in this ward with other people who could not afford to pay their medical bills, and thought to myself, I failed. As father and husband, I didn't do the basics. I didn't have health insurance when my baby came along. Well, there were some wonderful people who did some wonderful things for our daughter, and I'll never forget it. But I'll also never forget sitting in that chair wondering who would come through that door and be my daughter's doctor. I would be meeting him for the first time. I've never felt so helpless as I did at that moment. As lawmakers, I believe our job is to help make life a little bit better for the people we represent. And this week, it means tackling the quality, affordable health insurance issue. It's no secret what happened in this chamber over the last several weeks and months. We had the longest government shutdown in history, 42, 43 days, depending on how you calculate it. But it was a record. And the issue was whether or not we would do something to provide health insurance to some 20 million Americans who stand to lose it because the premiums are too expensive. We went back and forth, and every day I came to this floor and stated our position on the case. Senator Thune, Senator Barrasso stated their position. Senator Schumer, of course, was part of this dialogue that went on week after week. The decision was finally made by a number of us to end the government shutdown by voting to open the government. There was an understanding that certain things would happen. Appropriation bills would pass as part of the continuing resolution, and many agencies of government, which were in a questionable position, would be funded. That was important. But when it came to health insurance, we reached an agreement that this week, before the Christmas recess, we would have a debate and a vote on extending health insurance. Why are we doing this? Because the Affordable Care Act passed under President Obama provides tax credits, help in premium payments for millions of Americans who could otherwise not afford to have it. And the decision in the big, beautiful bill, the budget bill of President Trump, to end those tax credits meant that millions of Americans stood to lose the health insurance that they had before, starting January 1st, with new and higher premiums. Senator Thune promised to vote, and I believe he told me personally he would keep his word, and I believe he will. I think we'll have a vote this week. But a vote is not enough if we can't come to an agreement. We need 13 Republicans to join us in a bipartisan effort to extend this tax credit so that millions of Americans don't lose their health insurance. 13 of them. They need to step forward and, frankly, join us in a bipartisan effort. There's a lot more to be done. This is not all that we will do. But extending this health insurance premium assistance to these families can make a real difference. Let me tell you a story. If you're looking for breakfast in downtown Chicago on a Sunday morning, let me recommend a restaurant. The name of the restaurant is Lou Mitchell's. Lou Mitchell's restaurant is in the shadow of Union Station, the Amtrak station in downtown Chicago. It's 2 or 3 blocks from our Catholic parish, and we're there regularly on Sunday mornings, 8 o'clock. Got 2 stools by the counter that my wife and I sit in and eat breakfast. We've come to know just about all of the waitresses and helpers in this restaurant. It's legendary by Chicago standards. They claim to be the starting point for the creation of U.S. Route 66. And there are people literally coming from all over the world to make that journey down Route 66 and start with breakfast at Lou Mitchell's. Donna Fenton is my personal friend, my wife's as well, and she is the maitre d' at the breakfast restaurant. She's 94 years old. She never misses a day of work. She's a wonderful person, a diehard Cubs fan who wears earrings with the Cubs logo on them. I've taken her to games over at Wrigley Field, and she, even at her age, is just as lively and involved as any person in the whole audience. Yesterday, when my wife and I went to Lou Mitchell's for breakfast before church, I had a conversation with another person there on their staff, a waitress. She's a manager as well, and she's been working at this job for years. She's 63 years old. Her husband just qualified for Medicare, and she felt relieved that that worry about his health insurance would be taken care of. She then found out that the Medicare Advantage program that she would be having him sign up for runs $200 a month. Her original premiums that she's paying for health insurance for him and for her is $279 a month. So right off the bat, she faced an increase over her base premium that she's been paying for some time. But she had the good fortune, at least now, up to now, to have a tax credit to help pay for those premiums. Then she got the notice from her health insurance company that the cost of her insurance, even with her husband not covered by the same policy, is going to virtually double. I can tell you this is a hard-working lady. I've come to know what it means to be in your 60s and still working as a busy waitress in a busy restaurant. It isn't easy, physically demanding. She's had orthopedic surgeries and other problems occasioned by the fact that it's just an active life at a time when most of us like to think we're going to close that chapter and take it easy. She's not able to. And she said to me, what's going to happen to me when I can't afford health insurance? And I thought back to my own experience here in Washington. I said, well, I hope you don't get sick. It's the best I can say for you. And she said, who wants to raise my premiums more than double them? Who is behind all this? And I said, unfortunately, there's a political difference here. I won't go into details. It'll sound too partisan. But there are some members of the Senate who frankly know you're going to have to pay twice as much and really don't want to see any changes made. Let it go forward. I think that's unfair to her. I could give you her name, but I'm not going to because I didn't ask her permission. But I believe every word she told me. Hard-working woman, 63 years old, whose health insurance is going to more than double each month. She doesn't make a fortune as a waitress. She makes a basic wage in tips. And now she's asking me, as her U.S. Senator, why did you do this to me? Well, my answer is we have a chance this week to change it. And that's what I told her. If we can get a bipartisan group to agree to just extend these credits, we're going to be able to bring your premiums down to be more affordable. Won't be the same, it'll still be high, but it won't double or triple, which is likely to happen otherwise. I think about her as I stand on the floor of the Senate and think of the tears in her eyes as she talked to me about what her life is going to be like if we fail. We can't fail. We have an obligation to her as Democrats and Republicans. Are there things we can do to deal with the Affordable Care Act? Yes. I still think it's fundamentally sound, but there are elements in it that need to be changed. We look forward to not only extending these tax credits, but also a meaningful bipartisan gathering in the appropriate committees to talk about changes of the Affordable Care Act. Now, there are some people who want to see changes that are politically volatile. to go into the issue of abortion now instead of just extending these premium benefits, I know because I lived through the Affordable Care Act, is a non-starter. It's a poison pill. It's the end of the conversation. We're too divided on the issue. Prior to the ACA, we must remember that insurance companies could deny coverage to patients with pre-existing conditions. This waitress I'm talking to you about has a long list of pre-existing conditions now, and I won't go through them here. But under the old school, before the Affordable Care Act, she would have had exclusions in all of her health insurance policies for all of these medical conditions. Under the Affordable Care Act, she must be offered health insurance, regardless of pre-existing conditions. If someone had, for example, a history of diabetes, heart disease, or even a past pregnancy, insurance companies used to be able to exclude those services from your plan or charge you an amount that you couldn't afford. Thanks to the Affordable Care Act, insurance companies are no longer allowed to discriminate against patients with pre-existing conditions. We required in that law that health insurance plans cover comprehensive benefits, hospitalizations, prescription drugs, and even mental health and addiction treatment. And we allowed children to stay on the parents' health insurance until the kids reached, no longer kids, young men and women reached the age of 26. What was the result? It worked. For 15 years, it worked. We achieved the lowest number of uninsured Americans in our country's history. Millions more Americans suddenly had peace of mind of having quality health care. But faced with high costs from expensive medications to specialty treatment, too many hardworking families were struggling to keep up with the rising price of health care. I've heard my colleagues on the Republican side who didn't support the bill when it was created come in and say, but health care still got too expensive. That's a fact. But imagine if there was no help in paying the premiums, what families would be doing with these increased costs. You want to know one of the reasons that the health insurance is so expensive? I've asked Blue Cross Blue Shield in Chicago, and they tell me it's pretty simple. Did you ever see an ad for a pharmaceutical product on television? I'll bet you did, and I'll bet you saw more than one. They play them all the time. There are only 2 countries in the whole world that run these ads for drugs: United States of America and New Zealand. In every other country, it is prohibited. What difference does it make? People get in their minds these drugs just might be the cure for my problem. And they go to the doctor's office and they sit down for the 10 or 15 minutes that they have with that doctor and say, I've been hearing all these ads about Xarelto. And the doctor says, Xarelto, I'm surprised you can pronounce it. The person says, I can spell it. I've seen so many ads. I think I need it, doctor. And in too many cases, the doctor, rather than get into a debate or say there's a cheaper generic for this drug or the other, ends up writing a prescription for an expensive drug. It's one of the major reasons that health insurance premiums have gone up so high in the United States of America. Now, I have a bill that eliminates direct-to-consumer advertising as approved and requested by the American Medical Association. I won't be able to add it to this bill. I want to, but I'm prepared to join in the debate about making our system better and more affordable that will follow after this vote. So what I'm saying is this. The Affordable Care Act is so important. It's one of the most important votes I ever cast. I still stand by it. But it needs to be improved, and we need to do that. We won't do it this week. But this week, let's give peace of mind to my friend who's a waitress at Lou Mitchell's and others that have written to me from all over the state of Illinois, that they can afford health insurance, that their premiums will get a helping hand. It takes 13 Republicans to join the Democrats for that to happen. It has to be bipartisan. As a result of the enhanced premium tax credits, the number of Americans covered in the ACA marketplace plans has increased from 11 million in the year 2020 to 24 million this year, including my waitress friend at Lou Mitchell's. In Florida, the number of residents with health care coverage has doubled since the passage of the Affordable Care Act. In Alabama, tens of thousands of children and older Americans obtained health insurance for the very first time because of the Affordable Care Act. Why do we want to reverse this? Why do we want to put the waitress that I mentioned to you in a situation where she can't afford her premiums anymore? That's going to happen in just a few days if we don't act, and act in a responsible, bipartisan way. This summer, congressional Republicans eliminated $1 trillion in spending for Medicaid. It's a different but related issue. This will take health care away from 11 million Americans and threaten rural and inner city hospitals. But in also refusing to extend premium tax credits, 22 million Americans may see their health premiums double on average. Double what the health insurance payments were just today and a few weeks ago. These could raise by more than $3,000 next year. In Jackson County, Southern Illinois, an area of small towns and rural areas, residents there on average will see their monthly premiums go from $122 a month to $458. That's a difference of $330 a month, a 274% increase. Crawford County in downstate Illinois, monthly premiums rise from $170 a month to $517, a 204% increase. That's why our vote this week is so important. We can stop these premiums from increasing in my state, in Alabama, in every state that people are affected by it. In Western Illinois, residents on average will see a 120% increase if we don't do something this week. What's our excuse? We're too busy? Look around you. Does this place look too busy? Not to me. We used to have legislation on the floor regularly, and amendment, and debate, and we'd actually pass laws that had to be considered by both the House and the Senate, and it would happen. It doesn't happen anymore. We come to the floor and make a speech. We may once a month have something to vote on the floor. This Senate is described as one of the great legislative bodies, deliberative legislative bodies in the world. You couldn't prove it by a history of our schedule over the last several months. This week, the Senate Democrats are going to put forward a proposal to extend health insurance premium tax credits for 3 years. I've heard some Republicans say, well, that's too long. Well, come back with an amendment for 2 years or 1 year or something. Show that there's a beating heart there that actually cares to solve a problem that affects a waitress in a restaurant in downtown Chicago. We've tried many times to have this debate. It never gets off the ground. But now we've come to a moment where January 1st, the world's going to change for millions of Americans if we do nothing. I want to work with the Republicans on this bill. I want to make the Affordable Care Act better. But we've got to take care of the immediate crisis before January 1st. If Republicans, 13 brave Republicans, will step up and say, we want to extend the tax credits, there's going to be an opportunity for us to sit down and say, all right, what do we need to consider to do to make the Affordable Care Act better? There was an editorial in the Wall Street Journal this morning. I don't usually buy that newspaper, but I'm glad I did. There was a long list of things they raised questions on when it came to fraud in the Affordable Care Act. It's legitimate to raise those questions. We should ask that of every single program. They suggested in their editorial that tax credits are somehow an inducement toward fraudulent enrollment. The Wall Street Journal came out with an editorial, as I said, highlighting the findings from the General Accounting Office, the congressional watchdog. My response, sign me up to sit down, put that editorial on the table, and on a bipartisan basis address the very things that they raised. But let's not allow these findings about malfeasance by brokers of insurance, and that's the ones that they're blaming, not the patients, to be the reason that 24 million Americans face unaffordable premiums, and not the reason my friend, the waitress at that restaurant, is going to face premiums she and her husband cannot afford. To be sure, what the GAO found is unacceptable. There are proposals on the table that Democrats would support to crack down on malicious brokers who fraudulently enroll customers. No excuse. That's got to stop. I'll be part of it on a bipartisan basis if we get that opportunity, and I hope we do. But to argue that tax credits to help my waitress friend pay her premiums are the reason for fraud and therefore should be eliminated is the wrong conclusion. It's an outsized collective punishment to her, and what did she do wrong? We don't punish seniors when their identity is stolen. We punish the grifters who did it. And the same thing should be true when it comes to fraud. Let's hold those accountable for it, strictly accountable. Raising premiums so that patients have skin in the game would still not deter malicious brokers from their illegal behavior. We can address this, we should. And it would ignore the fact that the Medicare Advance plans also have zero premium policies. I don't hear any bipartisan howling about that. I'm willing to work with Republicans to take on fraud, but let's be honest about the scope of the problem and not use it as an excuse to abandon the tax credits that more than 20 million Americans rely on. I want to go back to that restaurant, maybe not next Sunday, but after Christmas, and tell that friend of mine that we heard her, and we did something about it. And we're going to give her a helping hand at a time when she has nowhere else to turn. She's working hard every single day and has done that all of her life. All she's asked us to do is to give her a fighting chance to have health insurance for her family. Isn't it really incumbent on us to meet that responsibility? Madam President, I yield the floor.